Hi, this is Dr. Sriman Narayana, surgical gastroenterologist and laparoscopic surgeon, Reno Hospital, Sanat Nagar. So, more common question is suppose if I explain to the surgeon patient, sir, this is the type of surgery, this is the procedure, how we do, this is the time, how much it will take. Then next question will be this: are any complications for surgery? So, any intervention, any cutting, even for small injections, also some issues will come. So, more common complications for the surgery is the leakage also chances, because we are attaching our pancreas to the small intestine. Leakaging of pancreatic juice, that is a very rare possibility, because we are attaching almost 10 centimeters anastomosis means attaching the pancreas to the small bowel. There is a leakage chances of 1-2% will be, but it is a very rare possibilities. The leakage will show within the 5 to 7 days only, not before 3 days it will not be shown, but more common in the 4th day to 7th day. So leakage, one is the chances will be there, and second thing is really the bleeding chances. Why I am telling the bleeding is, our pancreatic juice is a very caustic one. Very caustic means it can damage, it will eat enough, engulfing anything. Suppose during any surgery, any vessels are exposed, there is always a chance of eating of by a pancreatic juice. So second thing is the bleeding. So first one is the leakage, second thing is the bleeding, and sometimes suddenly the our anastomosis may break down, but it's a very rare possibilities. And fourth one is the wound infections. More common is the wound infection, because of leakage, because of anastomosis, because doing the anastomosis, there is always a chances our abdominal wound get infection, very rare possibilities. And thing is the prolonged ICU stay. It is not the complications. Nowadays, because of our anesthesia techniques and care, post-operative care, intraoperative during the surgery, very minimal handling of the patients. The BP also we are maintaining very less. So because of our anesthesia team is very good one, there is always a lesser chances of prolonged ICU stay, also very less. So suppose suddenly any bleeding happens, means after surgery any bleeding happens, we have to re-explore. Re-explore means we have to again do the surgery and control the bleeding control. But very rare possibilities for the pancreatic surgeries. These are the less complications for surgery. But the more common is suppose during the surgery, we notice some hard lump is there. We thought that is the chronic pancreatic tissue. But after frozen means we'll just cut the small tissue and send for the biopsy. If you notice any malignancy is there in that, we are unable to proceed. We will just bypass the pancreatic juice, liver juice and the stomach juices. We'll just bypass, and then we'll send the patient for the chemoradiotherapy, because we are unable to remove the tissue. Why few people ask why can't we remove the pancreatic tissue because of malignancy. In a chronic pancreatitis, because already healing process, fibrosis, our liver, blood circulation, our small intestine blood circulation completely engulfed. So without resecting the vessels, we can't proceed. But the problem is if we resect one and we have to do the vascular anastomosis, we can do, but there are always a chances of complications. So for that purpose, if the patient is tolerating, we can go for the vascular surgery, but most of the time we'll just do the bypass and go for the chemoradiotherapy. This is the complications and issues in the surgery time. Thank you.